Okay, these are the muscles of the hip girdles and lower limb. So when you have the gluteal muscle, this is the gluteus maximus, that can cause extension of the hip and lateral rotation of the hip. These are called the gluteus medius, this muscle and this muscle. Okay, gluteus medius, there were different views, same muscle. This is gluteus medius, gluteus medius. This is the gluteus medius, and deep you have the gluteus minimus, that just deeper than this area, but you cannot see it in this view. And gluteus medius and minimus can cause abduction and medial rotation of the hip joint. You also have the tensor fascia latae, and this is also called flexion of the hip joint. So these are the 4 gluteal group muscles. Then you have some other muscles here that you can see, but also I have it in a different view. So you have the rectus femoris and vastus lateralis. These 2 muscles are part of quadriceps muscles, and you have the biceps femoris muscles. You have the 2 heads, and this is part of the hamstring muscles. And this one that you see, this is called the iliotibial tract, starting from the ilium all the way to tibia, and that is just for a stabilization of that area. Okay, so the slide is not moving forward. Okay, so now the slide is moving. Okay, so again, you can see the gluteal group muscles. This is the gluteus maximus here, this cat here, and the gluteus medius, gluteus minimus deep, and tensor fascia latae. So there's 4 muscles that you can see it here. And then there is another group that you see is called iliopsoas muscles. This is a combination of 2 muscles. One is called psoas major, and the other one is called iliacus. So these 2 muscles cause flexion of the hip joint. Okay, flexion of the hip joint, and psoas muscle also cause flexion of the lumbar area. Okay, flexion of the spine and the lumbar area. Then is you have the lateral rotator group muscles. So this is called piriformis. So this is a group called lateral rotation of the hip, piriformis. So you can see in the background, superior and inferior gemellus muscles. In the middle, you have the obturator internus. So this is, you see it from the posterior view, obturator internus, which also you can see it here, and obturator externus, that you can see it from the anterior view. Okay, so then you have the quadratus femoris muscle, quadratus femoris. So all of them cause rotation of the hip laterally. You also have adductor group that cause adduction of the hip joint. So this is the pectineus muscle. Okay, this is gracilis. So this is located most medially. And then is adductor magnus, which is really big. Adductor magnus at the background. Adductor longus and adductor brevis. So all of them will cause adduction of the hip toward the midline. Okay, so this is the anterior view of the thigh. So you can see some adductor muscles and also some quadriceps muscles. So this is the gracilis. This is adductor magnus, not labeled, so if you want to label it. This is adductor longus there. Pectineus muscle is there. You cannot see adductor minor here. So then is you can see iliopsoas muscle. Iliopsoas muscles just passing below the inguinal ligament, which is an important ligament, starting from anterior superior iliac spine all the way to the pubic tubercle. You also have the sartorius muscle, which is the longest muscle, and that will cause flexion of the hip and also flexion of the knee. Then is the quadriceps muscles that cause extension of the knee. So this is the rectus femoris, okay? This is vastus lateralis, vastus medialis, and there is another one, it's called vastus intermedius. But that muscle, you have to remove the rectus femoris to see that. The name is called, once again, vastus intermedius. These muscles also cause flexion of the hip. Okay, extension of the knee, flexion of the hip. From the back, you can see gluteus maximus and medius, but these muscles are called hamstring muscles. Okay, you also see a couple of adductor muscles. So the hamstring muscles, this is the biceps femoris, so the two heads of biceps femoris, and this is called semitendinosus, and this is called semimembranosus muscles. So three of them. These are called hamstring muscles that will cause extension of the hip and flexion of the knee. These couple of other muscles which I showed it to you before. It's repetition here. So this is gracilis and adductor magnus. You can see it from the posterior view. They cause adduction of the hip joint. There's also some other muscles are here that is not part of the hamstring muscles, and one of them is this one. This is called popliteus muscle, and another one is called sartorius muscle that is located anteriorly. They too cause flexion of the knee, but they are not part of the hamstring muscles.